So I'm just going to introduce you to what you're going to need for giving a flush or some medication through an enteral line. In this case, it's a gastrostomy tube, which is shown here. This is the same mannequin as you will have to practice on this week. So, starting from this end, you've got your PPE. Now that really depends on the situation you're in as to what PPE you're going to need. I've put a mask in there, I've put an apron in there, and I've put some gloves in there. Working through here, you've got your syringes. These are 20mm syringes. You have probably in your home 20 and 50mm syringes. I've just got a couple of 20s here. I don't have a massive supply of them. And you'll notice that they're laid out to dry. That means that they've been used. They're less than 24 hours old. In other words, they need to be changed every 24 hours for new ones. And between uses, they need to be washed like you would wash up your dishes or something like that. And you would rinse them in cold water and you'd let them dry. Once they're dry, you can put them back together again. Trying to do this one-handed. You put them back together again and you can just put them in a pot or something ready for the next time. But please don't leave them standing in water or leave them wet. They need to be dry because wetness obviously contributes to the risk of bacterial involvement. So put them in there ready for the next time you're going to be using them. But again, 24 hours, then change them, all of them. Don't try and use them for longer. Looking over here, we've got a jug. As it says on the top, cool boiled tap water. For your jejunal tubes, which is probably the one you're dealing with, a jejunal tube will, the general procedure is to use water that has been boiled, tap water that's been boiled, and then allowed to cool. Don't put it in the fridge, just let it cool to room temperature. Make sure you have it in advance, you have it sort of properly set up. So you've always got a jug on the go of cool boiled tap water. Like I said, don't store it in the fridge. Really cold water will make your service user jump a bit when you give it to them because they've got no way of warming up the water. When you drink by mouth, you've got all of this distance before the water hits your stomach. So sometimes when you take a big gulp of cold water, it makes you sort of shudder a bit. Well, you can imagine what happens if you give somebody really cold water straight into their stomach. It might make their stomach quite spasmy. So room temperature, lid on the top, put a date on the lid as well, as we show here. Little cup in front of there, because you do all your mixing up in cups, you don't draw straight from the jug. So for instance, if you're going to do a flush, you're going to put some water in a cup and you're going to draw from that cup. Likewise, if you're going to mix up some medication and you're going to add some water to it, or you're going to decant it into a container, you're going to do that into a pot like this. So you're going to have your flush pot, if you like, and you're going to have your medication pot. Coming through here, you see the gastrostomy line here. This is a bit of a rig up, as I've said to your manager, that it's kind of it's made for simulation today. So you've got your gastrostomy line, which is a perfectly functional one for this mannequin. You can flush it, you can operate it, you can play around with it. Just want to point you out a couple of things, because your gastrostomies and your jejunostomies and your peg tubes will all be slightly different. This one is just an example of how we operate this. So you've got your line here. Any line that goes in percutaneously we describe as a stoma. So we're checking, as we say, we're going to check the stoma site, make sure the stoma is good, healthy, not inflamed, not looking angry. You've got some kind of retaining clip on here, and that retaining clip here is just to stop it migrating inwards or outwards, just to keep it where it should be. You just need to make sure that's nicely clipped together. There's a clamp here, and usually any clamp on the line itself, we normally say to keep that line, to keep that clamp open. You only close it very temporarily because we don't want the line to crush and kink. So if there is a clamp on there, most of the time it needs to be left open. Looking through here, we've got what we call a side arm or a port here. this is where we're going to inject our medication, or are going to squirt in our medication, not really injection, but where we're going to insert that. Next to there, you'll see this is a slightly distracting thing. First of all, remember your purple syringes won't be able to fit in there. So if you have got one of these things, that's what is an inflator. That is an inflator for the balloon. The balloon in this gastrostomy holds the thing in place. So it's like a urinary catheter. It has a balloon on the end, and that's the port that's used for inflating that balloon. So don't have anything to do with that. Don't try and put anything down it, because it won't work. So I'm not saying ignore it, but just recognise that that's not, in this case, it's a balloon. It's not for giving anything. So moving up the line here, we've got another clamp here. This clamp then leads up to the pump. There you go. That's all you need is some imagination. That's your feed pump, and there's the feed next to it. So if you've got somebody on feed, it will go from the container through the feed pump down the line into your patient here. So if this were running, the problem we'd have here is that clamp would be, oh sorry, that clamp is open, not shut. So that would be open, that clamp would be open, there'd be no problems here. So if we were running, then that would be giving medication, feed. So that would be giving feed. So we'd be quite happy with that. If the machine starts to alarm, there may be a problem with the line that needs flushing. There may be a multitude of problems, but that really isn't what we're covering today. But just recognising it, if the feed is going in, if you've got somebody on feed, then provided it's going in well, you can be pretty confident the line's working smoothly. I'm just going to take a little bit of a step back, just to start the sort of process of how we're going to do a flush. So we've got our client led down. Well, they don't have to be led down, they can be sat down, but just in a comfortable, usually it's sort of semi-recumbent, so you want them kind of, well, I can't really do it with this mannequin, but you need to sort of sit them up a little bit, so maybe just in a reclining chair or just in an easy chair, something like that. First thing to do is check that how well the service user is. So check them over. Do they look hot? Do they look bothered? Are they in pain? Are there any tenderness to the abdomen? Any problems you think are emerging here? Do you notice any distension, or do they have any bloating in the abdomen? Check around the site. Just check around the site, as I said before, for redness, any pus forming, anything around that site there. Sometimes the stomach acid can kind of come out a little bit. You can sometimes get a little bit of what you call like sort of bypassing, and it can make some redness and excoriation around the site, which can be quite unpleasant. Because the stomach acid has a pH of 1.5, it's obviously quite, it can be quite aggravating when it gets on the skin. So that adds to the reason why we do regular cleaning of the site. And just on that point of cleaning of the site, if you do notice any pus or anything around the site, idea is to give it a clean. So just use a gauze, wet gauze with just some water on it. It doesn't need anything dramatic, just 2 or 3 times a day, clean around the site, nice and tidy. And if the problem persists, then talk to your GP or to your nurse about maybe getting that site swabbed. Pus doesn't mean it's infected. Usually it can mean that your body's just trying to protect itself. That's what pus is really. So the area around here, if it gets red and angry, I'll show you on one of the photographs on the presentation. If it gets red and angry, then obviously you need to do something about that. The other thing that can happen on here is you can get granulation tissue forming, and it's rather like a sort of lumps and bumps that form around it. Look like they just look like sort of tissue that's forming. It's overgranulation, and that it's another response to having a tube in a foreign body. So that overgranulation is managed in a certain way. But again, if you see that, and I'll flag up a photograph of that for you. If you see that forming, then contact the person who deals with this, your GP or nurse, and they will advise you as to what to use on it. But it's not dangerous. It's not calamity. It's just something to be aware of. So, looking back, we've got quite a lot of things to bear in mind. So at this point, I'm just going to stop this part, and then I'll show you how to flush on the next video.